Hey Doc, how you doing?
Hello, hello. I'm good. How are you?
Good. Get in your bed, keep going.
How's everybody doing today? Come on in. Come on in.
I can't hear.
Can you hear me now? Yes, can you hear me?
Yeah, I can hear you. Mhm.
Testing one, two, testing one, two. It sounds low though. Okay, is that a better volume? Hear me okay? Welcome, 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 guys. We are talking tonight about how to answer the questions. And I think when it comes to the application questions, not the content, this is where most people really, really struggle. And you've had everybody out there, every tutor out there that's got their own plan. A, B, C, Safari, eat cake, eat pie, put them in order. What would you do? All of those good things. So tell me what you've learned in previous lives on how to answer the questions. What do you do first or last, or what's your technique?
Assess first.
Okay. So you've learned that from what we teach. Not all the other people teach that. Amber, what have you learned before you met us?
Before I met y'all, it would be safety first.
Okay. Did you learn safari or eat cake, eat pie, eat something? I don't know.
Yeah.
What's the acronym? What did you learn?
Well, from y'all, I learned the engagement, assessment, planning, intervening. What's into that? Terminate? I might have missed one.
Yeah, you're right. And
Okay.
termination starts at the beginning. You got it. Okay. Anybody else learn anything different? Because I think you have to have a plan when you get there. You're already going to be anxious. And if you don't have a plan of how you're going to answer those, not the recall ones, the application of what I do first, then it really gets confusing. And if you don't know, if you're using like eat pie sometimes and sometimes you use assess, then that makes it even more confusing. You've had an entire semester, either 10 or 15 weeks, and usually twice on the helping professions, or it was called the methods class of how we work. And that's literally what we teach.
Dr. Pam, I have learned about the five W's.
Okay. What, when, where, and why. What, when, where.
Yeah, what, when, why, where, something like that.
Okay. Okay. Again, so if
And
that's working
who?
for you, if it's working for you, then don't change it.
Uh,
That's not one that I agree to. Not what I agree. I think it's a reading test. You're going to stay in the test, the day in the question, but definitely what you learned in school was what we teach. Assess, assess, assess. You get paid to be nosy. We get paid to be nosy all day, every day. And we're always thinking first, next, it's still assess. Well, what do I do next? You do what you would do first. You assess, 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 assess. Now, there are reasons that I can't assess, right? So there's going to be, if their feelings are in the question, if feelings are in the question, feelings are in the answer. If I turned on the camera today and I was bawling, one of you great social workers would ask if I was okay, wouldn't you? I hope so, right? That one of y'all would, some feelings. And of course, safety trumps everything. But I'm not going to start with safety. I'm going to start with assessing. Okay, assess, assess, assess. Remember, termination starts at the beginning. The minute I'm writing the treatment plan, I'm trying to figure out when my client will be done. When you go to the emergency room, they're trying to get you out. Termination always starts at the beginning, whether it's the group, whether it's individual, a couple, it doesn't matter. In the beginning, well, I only have 6 sessions left with you guys. We only got 4 sessions left. It's almost over. It shouldn't be a surprise when it's over. Okay. Your plan, you always plan with the client, never for the client. And we teach the skills the exact same way, no matter who your population is, whether your client is your individual, a family, a group, or a community. You do the exact same thing. You assess, 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 right? You don't go into a community and tell them what to do. The community also they're not our lifetime partners. I'm not going to be in anybody's life forever. Assess, assess, assess. We plan with the client. The intervention part is then where most people get stuck. And I have to make sure that my intervention answers the right theory we're using, or somewhere in the question, it gives me a clue of what I'm looking for. More than anything, I'm going to say, prove it to me in the test. What words prove it to me? If it's a recall question, it's not as simple. A recall is you either know or you don't know, right? Have you seen the question like PRN, TID, BID, QRN? Have you seen those? That's a recall question. What's TID?
Back 3 times a day.
3 times a day. BID is twice a day. The H is hour. Those are just facts. Those are just facts that you have to know. PRN is as needed. Okay, there's probably not going to be a lot in the question to help me figure that out. I've just got to know what it is. Most of us don't get stuck with those, though. We get stuck with the ones of how we apply. So when do we seek supervision? There are 3 times, 3 reasons. Right. When countertransference gets in the way, my feelings get in the way, right? The other role of the supervisor is to run the agency, the daily grind work of who gets the next case and how our bills met and all those things. And then the last one is to make sure that we are taught. Okay, so they're to educate their staff, their trainees, things like that. By the way, whenever you see staff in the question, they're not all social workers. Remember that. They're not all social workers. They could be the doctors, the lawyers, the custodian people. Staff means they're not all social workers. So when we look at the questions, we're looking at what the question's asking us. Okay, what role am I playing and have I assessed? That's what we're always thinking first. Then we're going to go back to the question so we can figure out what's going on there. Seeking a supervision is very rarely the right answer. And most of you in your agencies, it's always the right answer. But for the test, it's really, really not. You are the very best. You're not going to refer to a peer at the LMW. At the LCSW level, you don't have a supervisor. It may say consultant, or it may say talk to a peer. Okay, but at the LM level, your peer knows less than you do. You're the very best one for this. Just some basics things that you need to know. I've heard should always means code of ethics. No. Should means what's best practice, not necessarily code of ethics. And the toughest ones to me are the best. The best is. Because you get 2 really good answers. I have to compare the answers to each other and go back to the question. Anybody want to ask me a question of something you've seen somewhere, something you've heard somewhere, a practice question you've seen you want me to go over?
Yeah, I do, Doc. To get my notes. So, what I seen somewhere is when you see best, consider the safest, most ethical option. When you see next, think about where you are in the helping process, then choose what step comes next. And when you see first, think safety and assess.
So I don't agree with that.
Okay.
Stick with a plan that works for you. So whatever works for you, stick with it. So just have a plan, because if you don't have an idea, when you get there, you're going up, down, left, right. So I don't agree with that. I'm always going to say, I'm always going to assess first, assess. Everything is a first question, not a next.
Okay.
First means I keep assessing. Even if you assess the first time, your client next time may tell you something totally different.
Okay.
Okay. And I think the best questions are, again, it's the best practice, but you're going back to the question. So, however you choose to use it, it's fine. Just stick with whatever works for you.
Thank you.
Is that what you're currently using? Is that what you used before? Tell me what you normally do.
No, I normally assess. Um, I just saw that. I saw a video popped up, a TikTok video popped up, and I listened to it. So that's where I saw that. But I
Hmm.
wanted to know what you thought about it. But I haven't been using it. I wrote it down because I want to know what you thought about that.
Have you tried it?
No.
Okay. If it works for you, I'm good.
Okay.
Okay.
So basically, you're stating that the only plan is to go in there and just assess. Not
I'm
only,
telling,
but
I'm,
only, but
I'm telling you that what we learned in school was to follow the social worker problem solving method. That's what we were taught in 15 weeks of school. We start off with assess. If the questions are in the feelings trump assess. Safety trumps everything. Remember that termination starts at the beginning. Okay. And treatment plan, we always write with the client, never for the client. We don't ever tell a client what to do. So the intervention is based on what the question is asking me, and evaluating is afterwards, but I don't need to get that far. So the safari, the eat pie, the eat cake, the whatever is based on what you learned in school. Okay, so I want you to always think assess. Read the whole question though. I can't just assess and I'll pick assess and be done. Remember, explore, discuss, refer for a medical evaluation is still assessing. Gather more information before you make a decision. Assess before you intervene is what I'm always looking for. Does that make sense? You can process it. I don't mind. Hi, Gloria.
Hi, Dr. Pam. How are you?
I am good. And
Good.
Yanni, are you new to us? Are you
Yes,
scheduled
I
with
am.
are you scheduled
I'm
with one
not.
of our individual coaches, or are you just sitting in on group today?
I'm just sending it on group today. This is my first
Okay.
time. I have two screens, so I'm looking at this. Wait, this is the screen that I'm looking at, but you're
Mhm.
actually on this screen, so you'll see me looking to the side.
I have four. So
Oh,
same thing. Okay. So when I'm looking over here, don't think I'm not listening. I have four screens. So yes, I understand. Are you a first time test taker?
this is my second time. I've been watching you guys on YouTube. I especially Mastermind. That is the face that I notice from all of the videos that I watch. So I'm like, okay, she's in the class. So that is it. I just watch the videos and I'm screaming Dr. Pam to the rooftop. I'm actually taking my test in a few days and I'm very nervous. Sorry that I waited so long to join the class, but here we are today. Happy to be a part of it.
Oh yes. What part of New York are you from?
Did you just hear my accent or did I say it?
Oh yes. No, I I hear you.
I'm from Harlem, Manhattan. From
I could, yes,
Harlem.
that's like so obvious. Okay. Okay, guys. LM or LC?
M.
M. Jessica's the state over. She's from New Jersey, right, Jessica?
Hey, Jessica.
New York. But I live in Staten Island. I might as well be in a different state.
Okay.
You know it. You know it.
One second, guys. I had this test pulled up too. Share my screen. Okay. So again, so we're just looking at what am I supposed to do? And I really don't care if you get the questions right. If you learn how to get the questions right, you'll get all the questions right. I'm sharing my screen. A 21-year-old woman seeks treatment for anxiety at a community agency. Sorry, somebody in the group. Okay. She brings her 18-month-old daughter with her to the session. The woman becomes angry with her daughter when she pulls things off the desk and shelf. The woman becomes frustrated and says, she never listens. She's such a bad girl. What does the therapist do next? I'm thinking, what do I do first? Okay. Before I look at any of my answers, what do I know about her? She's 21. She's young. She's coming in for treatment for anxiety. Okay. She gets angry with her daughter and she says she never listens. She's such a bad girl. Okay. So I'm thinking, can I assess? Can I assess? But I imagine mom is a little frustrated. She becomes angry, right? So in this one, I think I probably should acknowledge her feelings before I assess anything. But let's see what the four choices are. A, acknowledge the client's frustration with her daughter. B, request she find childcare for the next session so they can focus on her anxiety. Normalize the child's appropriate behavior, age-appropriate behavior, or explore client's early childhood history. Okay, what am I taking out?
D
Okay, could care less about her childhood history. Could care less. Okay,
and B.
now I'm going to compare the two answers to each other and go back to the question. Which one answers the question? A and C are both true, aren't they? The question is, what do I do first? And I know it says next, but she's coming in my office. The baby is 18 months old. She's in session. The one becomes angry. What's my better answer, A or C?
I say A.
Anybody disagree with that? If they were only that simple, right? Okay. Do we see how I got there? B is true. Isn't that normal for an 18-month-old? That's normal. That is normal behavior, but that won't help mom right now, will it? With me, you would? Okie dokie. Okie dokie. Crystal, take this one for me.
I have a feeling you was gonna call me.
You're just next in my book, in my list. That's all.
Brian
You
H.
you should be able to see each other. So if you see each other, you can see. Okay.
Brian, excuse me. Brian, 38, and his wife, Melanie, age 36, come in with their two children. Mark, age 9, Sarah, age 6. Their insurance panel referred them after Melanie's doctor encouraged them to get therapy. Melanie was diagnosed with cancer 3 years ago and recently found out that it has come back in several areas in her body. Brian, an Army officer, says, "We'll fight it like we did last time. We're fine." Melanie cries and says, "I'm worried about our kids." Brian is deployed and a lot, and Brian is deployed a lot, and I worry about who will take care of them if something happens to me. He doesn't want to deal with reality. Sarah looks at her mother with concern, starts to cry, and says, "I'll take care of you, mommy." Mark stares at the floor, motionless. Brian asks for fees because all the medical expenses. How would a system therapist treat their family?
Okay. So tell me about the question before I look at any of the answers. And if you've seen this question before, just let me know. I'll pull up a different set, guys.
So this is a system therapist.
Which means,
I need to apply a system therapist application or approach,
which means,
which means that's the method I'm supposed to.
everything affects everything else. Okay. Systems theory is Bronfman Brimmer. He talked about macro, micro, meso, right? Everything affects everything else. That's the systems approach.
Mhm.
Okay, so that's what the question's asking me. So Brian is 38 and his wife is 35. They've got two kids. She's got cancer. Melanie cries a lot. Brian is deployed. I'll take care of you, mommy. How would a systems family therapist treat this family? So do I assess or intervene? And at this point, I probably don't know until I look at the four choices. It says, how do I treat the family?
Treat them. Mhm.
Okay.
Explore their patterns of interaction when they are dealing with stressful issues, and assist the family in identifying supports outside of the immediate family. Rearrange the family members in the room to encourage expression of feelings and explore their families of origin, cope with illness and loss. Maintain healthy boundaries regarding the discussion of grief, and model effective communication and utilize role playing in session. Facilitate a discussion with all family members and plans in the event of Melanie's death, and explore how their families of origin cope with illness and loss. I would take out dig. Mhm. And I would take out say. Use the family members in the room to encourage expression. Rearrange the family members in the room to encourage expression of feelings, explore how their family origins cope with it. And I would take out big.
Okay, and why is my answer A? What word in the question proves it to me? The stem of the question.
Uh, I'm helping the family to identify their supports.
What words in the stem of the question
Oh,
prove it to me, though?
oh,
So because it's a
oh,
systems theory, like I
mhm.
said, micro, meso, macro, it's looking outside of their family. What else can they do for support?
They can look for other relatives to help them because
So
He's employed. Yeah, he's going to be deployed.
Okay, so do you see and why that's the right answer though? And I know you ruled out and you got to the right answer, but I want to know what words in the answer. Prove it to me.
Mm-hmm.
So is this an assess or an intervene? What did I do first?
I assess.
I assessed first. That makes sense. So I still assessed.
Mm-hmm.
So it's a systems theory. That's why I know because this is their family. So now they need more help outside of this family. So systems theory, Bronfen Bremer, that's the content behind this question. Every question is measuring a KSA. If I can figure out what they're asking me or what they're trying to measure, it makes it so much easier. Amber?
Tracy, a 38-year-old corporate lawyer, and her 28-year-old wife, Jill, a musician, self-refer for couples therapy. Tracy recently gave birth to a son with special needs. Tracy states, Jill doesn't understand my stress. I have to bill a certain number of hours or there is no way I'm going to make partner. She complains that Jill drinks and smokes pot nightly and doesn't get out of bed all day. I can't trust her with our baby. Jill responds, You're the one who wanted the baby. Don't blame me for your childcare problems while you keep working 15 hours a day. How should the therapist assess and clinically manage potential child abuse based on the case described in the vignette?
Okay, so tell me first what's happening in your own words. Paraphrase.
Okay, a couple goes to therapy. Um, and Tracy recently gave birth. Their child has special needs. Tracy is reporting that Jill doesn't understand her stress because she's trying to make partner, and Jill is smoking and drinking nightly and doesn't get out of bed, so she can't trust her with the baby. But Jill reports that Tracy is the one who wanted the baby, so she can't blame her for the childcare problems. And it's asking how the therapist should assess the situation and manage potential child abuse.
Okay. When I see questions like this, I've got to figure out the order. So, based on the way the question is written, I need to find the order that I'm going to follow. So, the question is asking me, how do I potentially clinically manage potential child abuse? Okay, so let's read all four.
Okay. A, determine whether the couple can adequately care for the baby, review parenting skills modeled by their parents, obtain a release to consult with the pediatrician. B, evaluate the current child care arrangements, explore why Tracy can't trust Jill with the baby, refer them to a support group for parents of children with special needs. C, evaluate the current child care arrangements, explore why Tracy can't trust Jill with the baby, process reactions to a possible child abuse reports. Or D, file a child abuse report based on Jill's neglect of the baby, obtain a release to consult with the child's pediatrician, refer a couple to a support group for parents of children with special needs. Whew.
Don't you hate these?
No, it's all right. I'm just part.
I hate these because I have to decide the order of which they're supposed to go.
Okay.
Anything I can rule out.
I would rule out D.
Okay, and why?
Um, I wouldn't file a child abuse report based off Jill's neglect.
Okay. First of all, we don't
And
file on neglect. We usually talk to the parents, and we don't have any neglect yet, do we?
not really.
She says, I can't trust her with the baby,
Yeah.
but I don't see anything. But we don't file on neglect. We report abuse, but we assess on neglect. So D is out. Okay. What else?
Mm, I would eliminate I would eliminate B as in boy.
Okay. Why?
Um, I don't know. I feel like the support group for children with special needs, I don't feel like that's just, mm, I don't know. Kind of, I don't know. I just don't like that last part.
Well, we'll just go on how you feel. How about that?
Okay, yeah, I just don't feel
Okay,
like they
so
trying to feel like it's trying to trick me.
okay, so you're down between A and C.
Yes. Um, ooh, I'm going to eliminate C. No, yeah, yeah.
Are you going to go with A?
I'm gonna go with A.
Anybody else want to give any feedback?
I was gonna go with C, but I don't know.
I don't like the last part of C. I don't know.
So what's wrong with C, the last part?
It's nothing about child abuse, I guess.
Yeah, the child abuse part, like reaction to possible child
Do
abuse
do
report.
I possible reactions to the whose reactions?
I mean, their reaction?
Do
Or
I care?
no, you shouldn't.
I don't care how they react. That I could care less. And I definitely have taken these two out. So now between A and B, how do I do A?
Uh, assess?
And how? I'm a neonatal specialist. I'm gonna ask them to bring in the baby so I can see the baby. I'm gonna go and watch how much milk they give the baby. Tell me how I'm gonna do that.
I was saying based on what they tell you.
Is there enough in the question to support that?
Mm,
Minette, what do you think?
Well, I, at first I was with her on A, but I understand what you're saying now because determine whether the couple can adequately care for the baby. So you're saying that we don't have enough expertise to determine if they can care for the baby.
What class did you learn that in grad school?
We didn't. I don't. So I guess the answer is B.
Okay. I do like the second part. I like review parenting skills modeled by the parent. If the baby to bring the baby in, right?
Uh-huh.
I can do that. But do they bring the baby in? Is the baby in the session?
No.
They're overwhelmed. They're overwhelmed. Jill's smoking pot all day long. She's drinking, smoking pot, and they just gave birth with this baby with special needs. You know when you just gave birth to a baby, special needs or not, you're overwhelmed. And one partner's trying to work all the time, and the other one is dealing with it by smoking and drinking. B is my better answer.
Okay.
So if we can get childcare, right? And then I want to know why Tracy can't trust Jill with the baby. She's like, I can't trust her. Do I know why? And a support group would be really nice to know that we're not the only ones that have a special needs child and we're overwhelmed. Thank you for being brave. Okay, how do we feel about it, guys? Did that make sense? Did we see how we got there?
Makes sense.
Do we struggle with those?
Sometimes I think I struggle with I guess the shock value of the question within itself, and it like throws me off. Like I was like, "Oh, this is awful," but I have to just remember that it's a reading test and that these are not real. They may be real scenarios, but it's not real.
Oh my God, this is mild based on some of the families we've seen.
Yeah, but
This
I'm like,
mild.
this probably happened to me. I'm like, I already have ACS on speed dial.
Mild.
But it's just it's sometimes it's the question within itself with all this stuff. And I have to also remember that I've been doing this at least for 36 months according to the board that said that I can sit for this
Absolutely.
test.
Absolutely. And I've seen worse than this. I've seen so much worse than this. Okay. So definitely. That might be some transference, some counter transference there.
100%. I mean, I can't seek supervision on the test though, or consultation.
No.
Dr. Pam, when they say process reaction, process reaction to a possible child abuse. What does process reaction? Or it's just
How
possible child abuse?
how will my client react when I tell them I'm calling?
Yeah, because B and C appears to be similar until you get at the end.
Got
Because
it. Got it.
at the end, so I had got caught up with I in my head. I initially said C for possible child abuse, but because I got
Okay.
caught up with the process reaction.
So do I care about their reaction?
Uh,
I do, but that's not on my
I,
priority list, is it?
so basically, process reactions is about them. It's not about the kid.
It's about they're my client, and remember, if we've got a client that they've told us what's going on, and we tell them we're going to call, or we call them within our office, we risk there's a risk of damaging that relationship, right?
Yeah.
What's the priority though? Losing the relationship or saving the kid?
Saving the kid.
Mhm.
So I really don't care how they react. I mean, that's mean, but no, my priority is making sure this kid's okay. Makes sense? Yanni, this is yours.
Okay. A 29-year-old client reports having a history of relationship difficulties. He is currently in a relationship and shares that he gets angry when he is not in control of the situation. He adds that he speaks to his mom on a daily basis and she is highly critical of him. What intervention would a cognitive therapist use in the middle phase of treatment?
Just in treatment. I took
Do you
out
want
the
me to read
middle
out?
phase. Sorry. Just in treatment. I took out the middle
Okay.
phase and for the test. Okay.
Okay, so
So
wait.
tell me
Okay.
tell me what's happening.
29-year-old having relationship difficulties. In a new relationship, his mother is critical of him. And the question is, what intervention would a cognitive therapist use?
Okay. And I'm thinking CBT.
I'm
So the
just going to
question that they're
read this
trying
to
to
myself
measure.
first.
Go ahead. Go ahead. What they're trying to measure in this
Yes.
question, though, is if you're a CBT person, what intervention would you use? Okay.
Okay. Okay. I would get rid of
Can you read all four out loud for my recording?
instruct the client to limit contact.
Can you read all four out loud for my recording?
Can you hear me?
Can you hear me?
Oh, sure.
Read
Explore
all
the
four.
client's
Yeah.
feelings. I can. Okay. Explore the client's feelings towards the therapist and the history of the client's relationship with his mother. B. Assign homework to identify triggers to his anger. C. Instruct the client to limit contact with mother. And D. Confront the client's problematic, automatic thought patterns.
Hmm?
I would eliminate C. first. Okay. I would also eliminate D. Wait, I won't eliminate D. Not yet.
Okay.
Assign homework to identify for explore the feelings. Explore the feelings. I had a quick question because I'm looking at where it says explore the client's feeling towards the therapist. So I was thinking about eliminating that. But when I see and the history of the client's relationship with his mother.
Let's go back to my question. How does CBT work?
Remove.
You got stinking
I
thinking.
hear
If I
you say
change the way you,
thinking,
yes,
like to remove.
do it, restructure your thought process. If I change your thoughts, I'll change your feelings and
Yes.
your behavior. So I'm looking
Okay.
for terms that belong to CBT. What would a CBT
Okay.
person do? They're not going to explore your feelings. CBT doesn't, they want to change your thoughts. They're not going to start off exploring your feelings. Okay, so CBT is cognitive therapist is what I'm focusing on.
Okay.
So both A and D are both CBT answers. The question is, which one would I do and which one can I prove in the question? Go back to my question.
Okay.
So 29-year-old, history of difficult
I would.
relationship.
I would choose D.
You would
I don't
choose
know how I
D.
feel about confront. Assign homework to identify triggers.
Automatic thoughts are we don't confront, we just try to change. So Beck says you've got stinking thinking. He tries to question your thought process. The way that you think is wrong. When I confront, it's going to be when there's a behavior that's coming out of my mouth and a behavior doesn't match. If he says, I've been trying to give up drinking and I had a drink this morning, we confront.
Okay.
Okay. And this one, I know that CBT uses homework.
Okay.
Okay. And if I can stop the anger, the triggers, if I can do the
Yes.
chaining and stop where it's coming from, then I won't explode. I'm trying to change the way that he thinks. CBT says you've got stinking thinking. Does that make sense?
Okay. I understand. Yes, it does.
For most of my clients, that's where the issues lie is you don't know the interventions. You don't know the clinicians, what they'll do. CBT is on every test, whether you're LM, LC, it's always there. CBT says you've got stinking thinking. Beck says depression's not real, right? He's gonna say, prove it to me. What's going on with you? How do you know it's not real? So keep going on and on and on. Socratic questioning is sometimes a term he uses. Everybody get that?
Yes.
When you get down to the two and you get stuck, we go back to the question, back to the question. They're giving you hints and clues. And the clue of this one was, what does a cognitive behavior therapist do? Gloria? Oh, I'm sorry, Jessica. I skipped you there.
A therapist is facilitating a group for mandated teenagers who are part of a foster care system. A new member joins the group after it has began going for a few months. What should the therapist address in the initial group session? Um, okay. We are a therapist in facilitating a group for mandated teenagers who are part of the foster care system, and we have a new member that joins our group after it has begun for a few months. How should the therapist address? I guess how should the therapist address the initial group session? Um, so A, the group rules, B, the expectation of confidentiality, C, the history of the group, D, the goals of the group. So, um, I think that at first glance, I would eliminate C, the history of the group.
Okay.
Therapist facilitating group for mandated teens who are part of the foster care system. A new member joins the group after it has begun going on for a few months. What the therapist address in the initial group session? I still would kind of like keep A and B, but I would also keep D, so it's pretty hard. Um, but
So I'm always looking at when they're dropping hints and clues for me in the question. Okay, so it's a mandated for kids who are part of the foster care system. What is something I want them to know in the beginning?
I mean, you would still want them to know the rules, the expectations of confidentiality, but that's also equally as important as the goals of the group. Like, what is the overarching mission of the group?
You got to pick one.
I know, and they're
There's
all
not an
good.
essay subversion at the test.
Because if that was the case, I probably could. I feel like I would pass. Um, they're part of the foster care system.
And they're
Um,
mandated.
they're mandated. Um, I would go with B, the
Yes, you
confidential.
would.
Okay.
Yes, you would. Yes, you would. Yes, you would. Okay. So why?
Because if I'm reporting to the court, they're mandated at some point here, and it's the yes that it's confidential, but I still have reporting to the court or some mandated system, some processing that I'm having to go. So what stays in group doesn't always stay in group. It's going to get reported. Your participation, all that other stuff is subject to, whoever you're reporting to. So that's the only reason I went with that one.
Okay. Makes sense. They're all important, but I'm mandated. I want you to know before you open your mouth, everything that you say to me is not necessarily confidential. I answer to the court. Yes, I want
Self-doubt
your
is the
rules.
awful part of this.
Okay, but remember that when they dropped those things in there, they put in there for a reason. They didn't just drop that they were mandated for no reason. That was the hint they gave me.
It's a reading test.
I heard that somewhere.
I have absolutely no idea. It's just something that's been going around the internet for the last, I don't know, 10 years.
Gloria, how are you? I talked to you, but I didn't say. Have you tested recently? Or are you testing soon?
No, I'm still waiting to get a date. So I called in about a week ago, so they're
Okay.
looking to find me a place. So
Okay.
hopefully testing soon.
Okay.
Yeah. Okay, so a 10-year-old girl is brought into therapy by her parents because she has developed an intense fear of the dark that is interfering with her ability to sleep. At the intake session, the parents informed the therapist that their daughter's fear has progressively worsened, stating initially she asked for the light on in her room at bedtime. Over the past few months, however, she has become more and more fearful and now is refusing to go into her room at night. The parents tell the therapist that the girl has been staying awake late and eventually falls asleep in their room. The girl is constantly tired and often falls asleep in school. How would a cognitive behavioral therapist address the girl's fear of the dark in treatment? Okay, so she's 10. The parents brought her in because all of a sudden now she's fear of the dark. She has fear of the dark and she can't sleep. And they're at an intake session, and the parents are informing the therapist that she's getting worse. Initially, she asked for a night light in her room, but in the past couple months now, she's become fearful. She just doesn't want to go in her room. So the parents are telling the therapist that she stays awake late, and this is making her constantly tired, and she falls asleep in school. So how would a CBT therapist address the client's fear of the dark in treatment? Help client and her parents develop a list of the least to most scary aspects of her room. Normalize the client's behavior and help implement changes that would make the client feel safer. Highlight times when the client was able to successfully sleep in her room and praise her for the behavior. Reframe the client's behavior as a way of increasing the attention she receives from her parents. Okay. So first, I'm gonna rule out what I wouldn't do. I'm not gonna go with D. Reframe the client's behavior as a way of increasing the attention she receives. Because I am a CBT therapist addressing the client's fear of the dark. Help client and her parents develop a list of least to most scary aspects of her room. Maybe, but not right now. I wouldn't do A.
A is your answer.
Oh, A is my answer? Okay.
What theory is this? Anybody?
Through CBT, is it
Wolpe, systematic desensitization. We create the hierarchy of the fears.
what did you say at first?
It's Joseph Wolpe, systematic
Wolpe.
desensitization.
Never heard of Wolpe. Okay.
Oh, yes, you have.
I've heard of systematic desensitization.
Yeah, and you might not have seen his name. Okay.
I haven't
but
seen his
yes.
name. Okay.
Yes. Okay. So what we do, right, is we come up with the list of hierarchy with the person, and
okay.
slowly desensitize them to what they're afraid of. There's a step before that is we have to come up with the relaxation techniques. We teach them how to relax first. Right? Take them to their happy place. You relax. You've come up with the hierarchy of your fears. And then when she thinks about a spider, you get anxious, you go back to your happy place.
Relaxation technique. Okay.
Okay, so that is systematic desensitization. Sometimes we'll see in vivo desensitization.
Yes.
That's all that is.
Okay.
Where were you going?
I wasn't sure yet. I had to look at my 3 answers again. I wasn't sure.
So B, normalize the behavior and implement changes that would make the client feel safer. Okay.
No.
CBT would probably not, that's not normal. This is an irrational fear, right? So I had to realize this is an irrational fear.
Yeah.
Highlight the times when she was able to sleep successfully in her room. Do you know what that theory is? Anybody? That's solution focused. SFTB, solution focused brief therapy. The miracle question, if you woke up tomorrow and the miracle had happened. So I'm going to highlight the times that she could do it right. That's the accept question.
Okay.
Does that make sense of sometimes why we're missing test questions? Because we've got to know the theory behind it. So it's an irrational fear. Ask me, guys. I think she's not the only one that struggled with that one.
Yeah, C was sounding good too, but I was kept going back and forth with CBT. I'm like, no, I don't think that's a part of a CBT approach.
So he is a CBT therapist. So the issue is he's changing the way that you think,
Right.
feel, and behave. So, and you may not ever see his name, but that's systematic, right? So we do it the other way. We do flooding all at the same time. And then
Right.
implosion is when you pretend like you're there.
Okay.
Jessica, you're looking at me like Dr. Pam, you just made that up.
Because I'm like looking at I'm comparing the two, and I was like, oh, I was like wondering like because I too have not heard of Wu Wei by name, but obviously I've heard of the process that he's done with the
Mm-hmm.
desensitization, and it does see I actually was leaning more towards A myself.
Okay. So the goal is if I can figure out what they're asking me, what KSA they're measuring, it makes it so much easier. Every question measures something.
Mhm.
I say every question measures something. Like, can you break that down a little bit more? When you take when the questions answer, did you say the question is measuring something?
Yes, so the KSAs are the knowledge, skills, and abilities that the test wants the board wants to say if you know. They're not trying to trick you. They are not trying to uh, uh, they're not trying to trick you. There's a whole list of things you're supposed to learn. So let me show you. Okay. So the KSAs are knowledge, skills, and abilities. Am I sharing that screen? Okay, I pulled up the one for the LMSW. Okay. This is where you find out where those points are coming from. So we know that human development has about 27%, assessment intervention 24%, 24% intervention, etc. And then there's a whole list of the KSAs. Okay, so under human development diversity, I'm supposed to know all of these things. Theories of sexual development, spiritual development, basic human needs, gerontology, personality theories, theories of conflict, body image, parenting skills, the family life cycle, role theory. Do you know what role theory is? Role reversal, role ambiguity, role discomplementary, role complementary. Theories of couples development, which is based on Margaret Mailer's theories of object relations. Okay. Strength-based and resilience theories. Solution focused is a strengths-based theory. It focuses on what's going right. Theories of group dynamics and group
Take
functioning.
care of that. Algae.
Are you talking to me, Gloria? Are you talking?
Oh, sorry.
Okay. So that is what I'm talking about when I'm telling you every question is measuring something. I'll put it in the chat box as the LM, but every question is measuring something, and there's a list of things that you're supposed to know. Does that make sense?
Yes.
It does.
Okay. So, and it breaks it down and it tells you what is under what area. So your interventions, right? The problem solving model, this is what we're doing, right? That is assess, assess, assess. And then the theories, solution focus or other methods or techniques, methods to engage and motivate client symptoms. That's usually MI, motivational interviewing. Okay, limit setting techniques. If your client calls you 17 times, what do you do? Okay. Role model techniques for harm reduction. Harm reduction is that if people keep drinking and they just drink safely. Okay, so all of these are the things that we are supposed to know. Evidence-based practice. CBT is the only evidence-based theory we have. The others may be evidence-informed, but CBT is the only one that's evidence-based. Okay.
Hey Doc, is this in the book? This in the blue and white book?
No, this is from their website.
Oh, okay.
This is the LM. I can put this LC.
Thank you.
It comes from the ASWB. It's on their site. Again, KSAs, knowledge, skill. So on my LC, there's 24% in human behavior, 27 on my LM. Okay, the same thing I'll put in the chat box. Assessment, diagnosis, and treatment planning, you see that there's 30% on the LC. And it tells you exactly what you're supposed to know. They're not trying to trick you. It's not a guessing game. We just have to know what they're trying to measure to see if I know. And what does it look like in a question?
Dr. Pam, is that the new guideline for the 26? The new
It hasn't changed yet. August 2026, and they put them in different categories, but nothing changed. All they did was change the domains.
Okay.
Okay, and I promise you that test is going to be harder. Those 3-question tests are so much harder. They are. They really are. God, they are.
Oh.
But the domains didn't change. They just changed where they put them.
So you would suggest taking it before the change?
I would. Oh my, if you only have 3 choices, you can only rule out one.
Okay.
So all the tests will be that way eventually. I teach the CPCE now, and that one is that way, but they're all going to be that way shortly. Does that make sense of where the questions come from and what they're trying to measure? So there's a list out there, and not made up by APGA or anybody else. It's just the board. It tells you what you're supposed to know. And that's how your school got credentialed by the board, because they say they teach these things. Okay, this is yours, Manette.
Okay. I see it. I don't see it.
Oh, I'm sorry. It's a mind reading test. There we go.
Okay. Okay, a 32-year-old woman who has been in treatment for 5 months goes through a major crisis and calls the therapist many times during that period. After the crisis passes, the client continues to call the therapist excessively. The therapist should. Okay, so you have a 32-year-old woman. She's been in treatment for 5 months for going through a major crisis. She called the therapist many times during the crisis. After the crisis was over, she continued to call the therapist. So the question is asking, what should the therapist do? A, track the number of calls and confront the client. B, tell the client that you will only accept a certain number of calls. C, inform the client you will start billing them for the phone calls. Or D, recommend the client meet you more frequently because it is clear he needs high level care. Okay, so I would rule out
Okay. Remember, I'm thinking, what would I do first? I'm
Okay.
always thinking, what would I do first? And I'm always thinking, can I assess before I intervene?
Okay. I'll rule out A because it's confronting the client. We don't confront.
I didn't say that.
Oh.
When do we confront?
Oh, we confront when it's, you said alcohol.
When their behavior doesn't match what they're doing. So if what's coming out of their mouth does not match their behavior, we confront.
Right.
Okay. I don't understand why anybody would ever spend money on those stupid Stanley Cups. I don't understand why what? I'm like 12. Okay. I'm lying. That's when you confront me. Okay.
Okay.
So
I wouldn't confront the client.
I didn't say that. I said you said you can't confront. And I said that's not true.
Okay, well, I wouldn't confront.
Okay, that's fine too. Okay, are you taking that one out?
Yeah.
Okay.
And I wouldn't I'll take out B because I wouldn't tell them that I would only take accept a number of calls. I would say D is the answer.
Okay. Is there any reason to confront them?
No.
Not at all. But what I want you to say is somebody's told you somewhere you don't confront, and that's not true. If the question is, if they're doing something that I need to confront, I'm going to confront.
Okay. Yeah, you're right.
Okay. I'm going to go back. Minette, yours again.
Okay. A 35-year-old single woman is referred to a community mental health clinic for parenting support and treatment of anxiety. She has two sons, aged 6 and 8, who attends a local school. She shares that they were recently evicted because the owners were selling the complex and adds that they have been sleeping in a van for the past 2 weeks. She says she feels overwhelmed and doesn't know how to get back on her feet. How should the therapist proceed? Okay, it's a 35-year-old single woman who was referred to a mental health clinic for parenting support because she's going through anxiety. She has two sons, 6 and 8, who attend the local school. She was recently evicted because the owner sold the complex, and she's been sleeping in her van for the past 2 weeks. She's overwhelmed and doesn't know how to get back on her feet. And this therapist wants to know what I'm guessing to do first.
Okay.
The choices are A, inform the woman that a child abuse must be filed due to the family being homeless. B, refer them to a shelter. C, complete a full assessment, including social supports and coping strategies. D, recommend family therapists to ensure the children are safe. I will rule out A, inform the woman that a child abuse report must be filed due to the family being homeless. I will also rule out C, completing the assessment. Oh,
I
wait.
don't know if I go there yet.
No, okay. I'll rule out D.
Now I'm between B and C. What do I do first?
The question is, how should the therapist proceed? Okay, so then I guess the answer would be C, complete a full assessment, including social supports and coping strategies.
I'm going to assess before I
Yes.
intervene. Let me get all the information first. Assess.
Right.
I may refer to a shelter, but not first. They may have family. There may be other options out there. I don't know until I complete my assessment.
Right.
May I
How would
say
you?
something?
Of course.
I was torn between the both because C does sound like the better answer, but I know I'm just thinking about everything that I've been listening to and learning, and I could have sworn that it was said that yes, you should assess, but ensure that this family is safe first. So I was kind of saying, should I get them to a shelter first and then assess next? So that is where I'm torn because if I'm thinking about safety first and then assessment, I would say refer to a
How do I
shelter.
know? How do
And I
I
know
know
that
they're in danger? Where in the question does it say they're in danger? Imminent
it
danger.
doesn't. It just says that she's living out of the no imminent danger. I just saw that she was living out of a van for the past 2 weeks. So I was just thinking shelter first.
Okay. So she
But
needs a
I know
place
this
to
is something that would
stay.
trip me
Okay. So let's
But,
up.
process a bit then. Okay. So
but she
so
also felt overwhelmed, like there's feelings within the problem. So I would assess.
I think you're assuming that she doesn't have any place else to go.
Yeah,
We
probably.
haven't asked her yet. Why would I send her to a shelter? And maybe she just her mother isn't answering the phone, or she's got some cousins a couple of streets down. I don't know until I ask.
Okay.
That makes sense. All I have to do is ask first. It doesn't mean I won't intervene.
Okay.
Yes, make sure we're good with that. Yeah, everybody. I get
Yeah.
that you're I mean, I
Um,
understand because that happens a lot.
Dr. Pam, but if you think about it, with the completing a full
so
assessment,
assess. I got it. Thank you.
would that would also mean because it's saying social supports and coping strategies, like with the full assessment, that like referring to a shelter would possibly be included in the C response. Is that what I'm
Absolutely.
understanding?
I'm
Okay.
saying that let me see if she what she needs before I refer. Assess before intervene. You intervene without asking questions.
I mean, are you asking me? No.
No, I'm telling you, we assess before we intervene.
I think it's for me, I'm always getting down to the two responses that are likely the ones that are the right answer, and then
Mhm.
doubting myself along the way.
So
So
the
that
test is written that way to get down to two.
so is that the social work helping process?
Assess first. Yes. Assess,
Okay.
assess, assess. Safety is imminent danger. I don't read anywhere in this question that someone's in imminent danger.
Just thinking about Maslow, the hierarchy, like the shelter.
It doesn't mean I won't do it, though. I still have to assess before I intervene.
If you're in session, you're not going to stop it and say, here, call this number. You're going to continue with the session.
Okay. So they were evicted 2 weeks ago. The owners were selling the complex, and as they've been sleeping in her van for 2 weeks. Have you seen the shows where people live in their trucks? Maybe she's no, I don't know. But honestly, before I refer to the shelters, let me ask her questions. Ask her a few questions first. Okay? That's all. That's all. Assess first. Jessica, take this one.
A young man enters an outpatient clinic complaining of noise in his head. Which of the following treatment plans should be implemented to provide a safe and effective care in the least restrictive level? We are a social worker in an outpatient setting, and we have a patient that's coming to us and saying that they're hearing noises in his head. Which of the following treatment plans should we be implemented to provide a safe and effective care at the least restrictive level? So, out of these responses, what treatment plan would we utilize that would have the client be safe, but also in the least restrictive level of care?
Mhm.
Okay. A, outpatient treatment with the medical evaluation. B, brief inpatient treatment with the medical evaluation. C, board and care placement without a medical evaluation. D, intensive outpatient treatment without a medical evaluation. This is not about me and what I do, Jessica. Okay. Um, I would eliminate B, uh, inpatient is the most restrictive, and you don't get to decide whether they leave or not. I would eliminate C, board and care placement without a medical evaluation. And I would also eliminate D, intensive outpatient treatment without a medical evaluation. So I would go with A.
Very good. Very good. And why? What words in the question support your answer?
Provide a safe and effective care at the least restrictive level. Outpatient is the least restrictive level of care. It's safe, and a medical evaluation would indicate whether anything else needs to be done.
Okay. And so the noises in his head, we're assuming, are going to be some delusions, right?
Yes.
Got it. Got it. How are we doing, guys? Have we seen these questions before? Are you finding them too easy? Tell me where we're at.
These questions are hard.
Just the goal is to teach you what the question is looking for. Okay. What are they looking for? Amber, you ready?
Your client expresses concern about changes in his wife's behavior. He reports that she has missed work frequently due to not feeling well, is less patient with their children, eats very little, and is losing weight. He also mentions that she has been withdrawing more money from their account. Money from their account than usual. Feeling at a loss, he asks for guidance on how to help her. A good question to ask the client is, so you have a client expressing concerns about his wife's behavior. She hasn't been feeling well, so she's missed work, losing weight, not eating much. And she has little patience for the children, and she has been taking more money out of their accounts. He's at a loss, and he's asking for guidance on how to help his wife. And they're asking, what is a good question for the social worker to ask the clients? A, had anything changed in your house or family when you began noticing these symptoms? B, would she be willing to come in for couples therapy or counseling? C, has your wife been to the doctor lately? Or D, does your wife use alcohol, drugs, or prescription medications? Okay. I'm going to eliminate B. I don't think it says anything about their relationship. It doesn't. So eliminate B. I'm going to eliminate A.
Now you're between C and D. You get down to 2 and you go back to the question.
Let's see. A good question. They're both great questions. Hold on. I want to pick.
Are you guessing?
No, I mean this is what I would ask, but this is what the
Okay,
text.
but go back to the question. There's some hints and clues that they've dropped in the question to tell you what you should ask.
I would eliminate D.
That's your answer.
Okay. I wanted to pick D because of the money part. That sounds like
Exactly. Go back to the question.
traumatic behavior.
Money is missing. They put it there for a reason. They are not trying to trick you. They're dropping hints and clues all day. Yes. When money is missing, my first gut instinct is where that money going?
Right.
Up her nose, I bet.
That, oh my
Okay.
God, it wasn't until Dr.
I was
had to
gonna
go
pick
back
that,
and
but
look at the question.
Mhm.
That's the piece that you're missing. You get down to the 4 and you just struggle with the 4 and you struggle with the 2, but go back to the question. There's money missing. And they're dropping little nuggets in the stem. Right there, right there. She's losing weight. She's got no patience. Not feeling well. I think that's what you thought, Amber, but you were afraid to answer that. Am I wrong?
No, I was gonna pick that one.
I think that's what you were thinking, but you
I mean,
changed your mind.
the quotes and the money for sure.
And also too, she's not feeling well, and then she's eating little, and then she's losing weight. So my first thing, I thought you're supposed to rule a medical first. You rule out, but I guess in this case, it's
I would if it didn't say that she was withdrawing more money than usual. That's a red flag.
Yes.
Look over here. Point to this thing of the question. Hello. Amber, I think that's what you were going to pick, but you chickened out. Yeah. That's like you're leaning there. But then you thought that can't be right. Every question is different. Every question you'll see is different. You can take 10,000 questions, and I swear to you, when you get the test, you'll never see the exact same question at all. It's a reading test. You're going to go back to the question. Prove it to me. How do I know it's the right question? They're dropping hints every day. Everybody gets the exact same test. So we don't care what you do in your office. We could care less. All that matters is what does the right answer based on the information they gave me. Okay, Crystal?
Karen, 35, has been married for 4 years. She is seeking therapy due to ongoing marital issues, particularly the absence of sexual intimacy for nearly 3 years. Karen reports a loss of sexual desires, which is associated with an abortion she believed was the right decision at the time. Her husband, discouraged by repeated rejection, no longer initiates sex. He contributes the distance in their relationship to the lack of privacy caused by living with Karen's mother. Despite these challenges, the couple enjoys spending time together, are committed to staying married, and both express a desire to rekindle their sexual connection, though they feel unsure how to begin. What should the therapist address first? Um,
Tell me about the question in your own words. Paraphrase.
Karen been married for 4 years. Second, third. Okay, so it's Karen married for 4 years, having marital issues. Um, due to absence of sexual intimacy nearly 3 years ago. Um, she lost sexual desires that's associated with abortion, which her husband discouraged it, and he no longer initiates sex, and he believes that contributes to their distance in their relationship, due to the lack of due to the lack of due to the lack of privacy caused by living with Karen's mother. Despite their challenges, they still enjoy spending time together, and they are committed to the relationship. And they want to rekindle their sexual connection. What should a therapist do first? See Karen together with her husband, refer Karen with a complete physical, see the whole family together, including Karen's mother. Obtain a detailed sex history from Karen. I will delete C.
You don't want Karen's mother there to discuss your sex life?
Nah, I'm good.
Mom might give you some tips and tricks. I don't know.
I would also take out big. And I will also, and I will
Okay, between
also
A,
take.
you get down to 2. Take the
Mhm.
2, you compare the 2 to each other, go back to the question.
Yep. Um, well, they're a couple, so you can't see them separately. Uh,
Hold on, go back to my question.
oh, what should the therapist address
No, the
first?
whole question, everything in the question. That's just not the stem, all those pieces.
Yeah, they're married. They're having some issues of sexual intimacy. They lost sexual desires. Uh, Karen reports she lost sexual desires. Um, due to this abortion, and which her husband discouraged it. So he's no longer interested in having sex, but they do have a desire to rekindle their relationship together, but they just don't know how they can go about doing it. So A, see Karen together with her husband, and then obtain a detailed sex history from Karen. Well, I wouldn't do D. It would be A.
And why? Tell me how. Karen is my client, right?
Karen, yeah, Karen is the client. Um,
A is right. But there's a rule, something like if I've already have a client, I can't see her with her husband. Isn't that a rule somewhere?
oh, she could see her with her even though Karen is the client, but she's having obtaining detailed sex history from Karen.
So the rule is if Karen is my established client, I cannot see them as a couple. Karen is already my client. But in this question, it says she's seeking therapy. So I need to believe that this is her first session, right? It doesn't say I've been seeing her forever and forever. So if this is our first assessment session, then I can see them together.
Mhm.
If it said Karen, I've been seeing Karen for 5 months, I cannot see them as a couple. I've already made a decision about Karen. That's not fair to bring her husband if I've already been seeing Karen.
So if this social worker was seeing Karen for 5 months, then the
I would have to
answer
refer them
would be
both to
D.
somebody. I would have to refer them both to somebody else. If I have an established, remember? So if my couple is the client, then I can't see them separately.
Right.
But if I've already got a relationship with one of them, then I cannot see them as a couple. It wouldn't make D the better answer. That just wouldn't be this question. But what you understand is by this one, because normally we say, oh my God, I can't see them together. But because it's only an initial session, I can.
Mhm.
Okay, does that make sense, everybody? So if I've been seeing Karen already, I cannot see them as a couple. And once I see them as a couple, I can't see them separately.
Dr. Pam, I just have a question. I mean, I wasn't going to go with D, but could you not see Karen and her husband as a collateral with client? Because the issues there seems to be there seems to be,
Okay, Jessica, you're thinking too much.
I am,
You're
but only
way
because
thinking too much. Okay. Could I see her husband once? Sure. But they need couples counseling. And I can do couples counseling because I haven't established a relationship with Karen.
At what point do you like if you it was seeing Karen? At what point is she no longer new?
They will say to you in a
Okay.
question, you've been seeing Karen for 6 months and her husband wants to come in.
Okay.
They're not trying to trick you. They're trying to let you know that a client is a client. If the family is my client, I can't see them individually.
Right.
I
Okay.
know we do it all the time, but the code of ethics says once you're my client, you're my client. So that's the rule. But in this situation, what they're trying to pick up on, remember, every KSA is measuring something. Okay, so the code of ethics says once we have a relationship, once you're my client, I cannot see you as a couple. If there's domestic violence and I've been seeing them as a couple, they both have to go see other people. I cannot see them together. I've been seeing a couple together, and it comes up that wife has a history of sexual abuse as a child. I can send her somebody else to someplace else to deal with that issue and still see the couple. That makes sense. I can still work on couples issues, but I cannot work with her issue because the couple is my client. Okay. Mastermind?
Thought you forgot about me, Doc.
Not at all. How could I?
All right. A therapist is employed as a clinical supervisor for a domestic violence shelter for families. During group supervision, one of the interns who has been working at the shelter for 8 months reports feeling detached from her family and friends, wants to avoid certain clients, and has been waking up multiple times at night. How should the supervisor respond to the intern's disclosure? So you have a supervisor and an intern at a domestic violence setting, and the intern has been there for 8 months, and she is reporting that she's feeling detached from family. She's avoiding certain things. She's not sleeping at night, and they want to know, how should I, as a supervisor, respond to the intern's disclosure? So we have A, recommend that the intern seek consultation with the MD for sleep disturbance. B, ask other group supervisees to share if they had similar feelings. C, provide psychoeducation on secondary trauma. D, after group, discuss whether intern is able to provide adequate care to clients. So I'm gonna rule out, let me see what the issues is again. So 8 months, she's detached from her family and friends, wants to avoid certain clients, has been waking up multiple times at night. House supervisor fire. So I would get rid of A, recommend the intern seek consultation with the MD for sleep. Let me see. Then let's see, after group discuss whether intern is able to provide adequate care to the client, provide psychoeducation on secondary trauma. Ask other group supervisors to share if they have had similar feelings during supervision. One of the interns was one. Okay, I would say C. Well, no. Wait. I
Let's
would get,
rule out. Keep ruling out.
so I would rule out B.
Between C and D?
Between C and D, I would rule out C as well.
And what's wrong with C?
Um, it's not nobody said it was secondary trauma.
C is your answer.
It is?
Mm-hmm.
Okay. So can I tell you
What's
why I thought it was D?
uh-huh.
Because it says that she want to avoid certain clients, right? Well, I guess that would be secondary trauma too. Cause yeah. So my question is then, if they're in group,
So what is secondary trauma?
secondary trauma is trauma that the client experienced through hearing somebody else's stuff or another client. Yeah.
That the therapist. So
Yeah.
secondary trauma is my trauma, right? It started with 9/11 and the therapist hearing the stories of the first responders who went in and what they saw. That's really when we diagnosed secondary trauma. So I
Okay.
am traumatized by hearing the stories.
Okay.
Okay. So now she works in a domestic violence shelter. She's
Mm-hmm.
an intern, right? Or she's intern? Yeah.
Intern.
One of her interns, right?
Mm-hmm.
She says, I'm feeling detached from family, friends, and I want to avoid clients and waking up at the middle of the night. That's trauma. Hearing those stories, now that's enough to know that's secondary trauma.
Right.
D can't be true though.
Right.
How
I was going
come?
to ask you that. Okay. So is there a rule that you can't, are you supposed to talk to them after group, or are you supposed to just?
No, not at all. What's said in group stays in group. Even in the internship, we discuss it in group, not outside of group.
Okay, so, okay.
Absolutely.
So
Absolutely.
group is group, no matter if it's an intern group or a client group, group is group, and the rules apply, same rules.
Absolutely. The same relationship between the therapist and the client is the same relationship between a supervisor and a supervisee. We're
Okay.
not buddies. We're not pals. We don't hang out together. We're not friends on Facebook. The same rules apply.
Okay, got it.
Okay. Everybody see where we got that? And again, that's one you have to glean all the information out of. Like, oh my gosh. So they didn't say secondary trauma, but they dropped hints and clues all day long to know that it was secondary trauma. Re-traumatization belongs to trauma-informed care. Secondary trauma is what the therapist does. You with me?
Yes.
Have you learned something today, guys? You learned something. Yanni?
A 28-year-old woman is referred by her medical doctor after he ruled out a medical condition as a cause for her insomnia. The client reports that she rarely leaves her apartment, smokes marijuana to take the edge off, and finds herself continually checking the locks on her door and windows. Upon further assessment, the therapist learns that the client recently relocated to California, escaping a violent relationship she had with the woman for 2 years. How would a therapist utilizing trauma informed care proceed? A. Obtain a detailed account of the past abuse and client social supports. B. Provide psychoeducation on the client to list the positive and negative consequences of each of her symptoms. C. Provide psychoeducation on a cycle of violence and refer the client to a domestic violence support group. And D. Explore the client's understanding of her symptoms and refer to a psychiatrist for medication. I don't see the rest of the rest of
Yes,
D.
I'm sorry.
No worries.
There we go.
So to sum it up, this client, she was referred by her medical doctor after they ruled out insomnia, smokes weed to take the edge off, was in a domestic relationship, moved to California, and the relationship was violent for 2 years. And the question is, how would a therapist utilizing trauma-informed care proceed? Let me just read this to myself. I would take out obtain a detailed account of the past abuse and the client's social supports.
It asks me about trauma-informed care. That's the intervention here. That's what matters. So
Okay.
what does that mean?
Well, it would be trauma informed therapy. No.
What does that mean? Do you know? Somebody tell me what that means.
How I sum that up is just therapy that's focusing mainly on trauma.
So the goal in trauma-informed care is the whole agency assumes that everybody that comes in has gone through some kind of trauma. So we
Okay.
assume that they have come from a place where they had no control. Instead of like saying, we don't want to re-traumatize. That's what I'm saying. We don't want to traumatize the client. We don't want to say, what's wrong with you? Go over there and sit down. We want to really give them, do you mind sitting in that chair over there? So the assumption is they've come from a place where they've
Okay.
had no control whatsoever. They don't trust the situation. So I'm trying to make it feel safe and that they're safe. But it goes down from the secretary through the janitor. Everybody knows that's how we treat clients in this agency.
Okay. So with that being said, explore detail. I don't understand what I'm saying. I want to rule out D, but exploring her understanding of her symptoms seems like something that should be done.
So let's rule out
And I know that.
something. Let's just rule out something.
Okay.
Okay. Is she in crisis?
Okay. I wouldn't say she's in crisis.
Okay. She relocated because she left a violent relationship with a woman 2 years ago. Okay. So then why is she coming in?
She was referred by the doctor.
Okay. Why?
Well, okay, so her doctor ruled out insomnia.
Mm-hmm.
She's smoking weed to take the edge off. I wouldn't consider it a crisis, but is she in crisis?
I don't think so. I mean, she's having some issues, but I don't think it's crisis, do you?
Yeah. No, I don't.
Okay. So, and do I really want a detailed history of her past abuse? And she didn't present for that, did she?
No.
I'm not going to ask her details of her past abuse. I'm not starting off there.
Okay. That'll be too far back. I would take out C.
I would have taken out B first.
I would go with C.
Okay.
I would have taken out B first. Provide educational common symptoms of trauma and ask them to list the positive and negative consequences of her symptoms. What the heck are the positive consequences of trauma? I'm just saying that. I just, mm-mm.
Okay.
Okay. Now I'm between C and D. That's where I want you to be. Okay. Is she currently in danger?
No.
No.
Is there any reason to refer her to a domestic violence shelter right now?
Oh, no.
No. No, there's not. So it just seems so seamless when you start explaining it, and then it's like, okay, I should have just chose that, but it does not come to me like that. Like,
it's
now
not
that you pointed
to.
out, she doesn't need to be
But
in a domestic violence support group right now.
okay.
Yeah.
But all I did was go back to the question. Go back to the question. Go back to the question. Can I prove it in the question? That's all that matters. Why does she need a psychiatrist? What would I diagnose her with, maybe?
PTSD.
What'd you say?
Well, you already did. They
The
already mention
basics would be at least
anxiety.
so GAD, or maybe some obsessive compulsive disorder. She rarely leaves her apartment. She smokes marijuana to take the edge off, and she's constantly checking her doors and windows. She can't sleep either. And she went to the medical doctor, and he said, "Oh, ain't nothing wrong with you." And then the trauma informed care is talking to her. Do you understand your symptoms? And then referring her to a psychiatrist. It's her choice, her decision. Do these feel like test questions?
They seem hard, and I'm happy about that.
Okay, so the goal is, and this is probably an LC question as opposed to an LM, but you'd still see trauma-informed care on both tests. Okay, and I'm going back to the question, back to the question. Okay, guys, we would like two more. Who would want this? Who wants this one? Maybe three more.
A 72-year-old wheelchair-bound man is referred by his doctor, who is concerned he is exhibiting signs of depression. The man shares that he recently had back surgery to address chronic pain and has been relying upon the wheelchair to get around for over a year. He expresses doubt that the surgery will help and frustration, that the surgery will help and maybe with his frustration with his children for not providing care. He depends on, Doc, you moved it. Let's see.
I did. I'm sorry. I just wanted to move it up.
He expresses doubt that the surgery will help and frustration with his kids for not providing, can't see,
I'm sorry.
the care
I'll
he
stop touching.
depends on and that they promised him. The client cries in session and tells the therapist, "I'm just so tired of it all. I'm done fighting." What actions should the therapist take to clinically manage the legal issues in this case? Okay, so we have an older man. He's in a wheelchair, and his doctor said he's exhibiting signs of depression. He had a back surgery to address some pain, and he's been in a wheelchair for about a year. He's frustrated. Looks like his children is not as supportive for providing care like they told him they would, and he's tearful in the session. He's saying that he's done fighting, and they want to know what legal issues. How do I help manage the legal issues in the case? Okay, legal issues. All right. Get a release to speak to the man's children and assess for possible neglect. B, assess client for potential self-harm and possible elder abuse. C, get a release to consult with the doctor about his treatment and process the need to file a report with the Dog Protective Services. D, assess for suicide and obtain a release. All right. Signs of depression. Recently had back surgery, chronic pain. So Doc, I'm a little confused about like what's going on with the kids because he expressed doubt that the surgery will help and frustration with his children for not providing care he depends on and that they promised him. I don't understand that.
They said they would help him, and I guess they aren't showing up. His frustration for his children for not the care he depends on. So he needs them,
Okay. All right.
and they haven't shown up.
Okay. He cried in session, tells therapist, "I'm just tired of it all. I'm done fighting." What action should the therapist take to clinically manage the legal issues in this case? Get a release to speak to the man's children and assess for possible neglect. Assess client for potential self-harm and possible elder abuse. Get a release to consult with the doctor about his treatment and process the need to file a report with Adult Protective Services. Assess for suicide and obtain a release.
What can I rule out?
Um, I would say I would rule out C,
Okay.
and then I also would rule out
Suicide.
A.
Now you're between B and D. Pay the
Okay.
two to each other, and which one answers the question?
Assess client for potential self-harm and possible elder abuse. Assess for suicide and obtain a release. I would choose B.
What's wrong with C? What's wrong with D?
Who you getting a release from? Too. You assess for suicide and obtain a release. I don't think
You're
that
right. C is my answer.
because he said his
Uh,
kids is not showing up for him.
Got it. However, D is not true because D is not legal.
Okay.
Assess for suicide is ethics, but it's not a legal issue.
Mhm.
This one, assess for potential self-harm and possible child elderly abuse, that's a legal issue. I've got to report elder abuse.
Okay.
Good job.
That was hard as hell, Doc.
Good job. Did it feel similar to the test?
Yeah, yeah. It's just a little bit harder than the test questions that I've seen. I think.
I don't think that they are. I think that we don't take the time to read the test questions,
Hmm.
and that's why we're not always successful. Test is hard. It's really hard. We've got to go back to the question, back to the question. This is one of the ones that I have to put it in order. What do I do first and then next? Okay. Crystal, take this one.
64-year-old widow brings her 19-year-old grandson Alex to you for evaluation. She reports that Alex, who lives with her, began having
October.
strange problems about 8 months ago. He has trouble focusing and doing ordinary day-to-day things. He is also often agitated and has a hard time sleeping. Alex tells you that voices in his head talks to him sometimes and he likes their company. Which of the following requires immediate assessment in order to evaluate risk?
What's the question asking me?
Um, what's the immediate assessment in order to evaluate risk for this 19-year-old who began to have strange problems about 8 months ago. He's had trouble focusing and doing ordinary day-to-day things. He's agitated and have a hard time sleeping. And he also mentioned that he has been that there's voices is talking to him, and he likes their company. Which of the following requires an immediate assessment in order to evaluate risk? Alex, suicide potential, Mary's coping skills, Alex need for inpatient care, whether Alex poses a danger to others, Alex ability to perform activities of daily living, Mary's mental status of Mary's social support system, Alex suicide potential, Alex mental status, Alex drug history, whether Alex poses a danger to others, Mary's coping skills, Mary's well-being, Alex suicide potential, Alex mental status, Mary's social support. Um,
Wow. Okay. The priorities.
uh,
What am I going to do first? Take the first part of the question.
The first thing I'm gonna do, I'm gonna assess for suicide
For who?
for Alex.
Where do you see that in his question?
Well, maybe not that. Uh, um,
If you can prove it to me, all you got to do is go back to the question and prove it to me.
all right, I'm gonna take the suicide out. I'm gonna take A out. Because he didn't mention anything about harming himself. Michael, Mary's well Mary's well-being, Alex suicide potential. I would take out D. Alex ability to perform daily activity with daily and I would take out B.
Okay, now you're down to 2. We get down to 2. We compare the 2 to each other and go back to the question. Okay, so how can I prove B or C in the question? That's what I'm looking for. What words in the question prove it to me?
Mm. But they didn't mention anything about no drug problems. So that would be a reason why I would eliminate C.
Okay. So B is your answer?
Yep.
Okay, and tell what words prove it to me?
Um, wait a minute. Alex able to perform. Well, he mentioned that he has trouble focusing, specifically during his ordinary day to day days. So that's perform activities daily. And then Mary's mental status,
So,
Mary's social
okay,
support.
can we stay with this for a bit?
Okay.
Who do we usually assess ADLs for?
Uh, uh, um, elderly people.
Do you see where I'm going with that?
Yeah.
Anybody want to and throw her a bone, give her some thoughts?
Mm-hmm.
Not at all. They're just leaving you out to dry.
Yeah.
I just don't know that I would assess Alex's ADLs. That's usually for older people. Is it not? Anybody assess ADLs on an 19-year-old?
No.
No, but I'm thinking about like maybe potentially negative side effects. So I'm like would wonder about his like mental status, anything else that poses a danger to others
I
for
guess
him.
and
Function.
if there's a problem with his ADL, then I guess you would check his mental status to see if there's a mental issue then at 19.
Going
And
back to the
Strange
question
problems
then.
are throwing me off.
Say what?
The strange problems are like leading me to believe that maybe the issues with his ability to manage day-to-day things could be a potential first break.
so that's mental.
It could be schizophrenic. It could be. It could be. It also could be drugs. Now, couldn't it?
Right. So it's C.
Strange problems started happening months ago. And my goal is to figure out what is going on here. I'm not gonna measure his ADLs. We don't do that with a 19-year-old unless there's something more in the question.
So it's C.
Alex's mental status, whether or not he's using drugs, whether he poses a danger, and how Mary's coping.
Because the negative, like that could be like the negative symptoms of like schizophrenia is like not managing.
What are the repeat that?
Like his negative symptoms. So when they're talking about trouble focusing and doing ordinary day-to-day things, has a hard time sleeping, I feel like those are like negative like effects of what potentially might be going on neurocognitively. So I would go with the mental status, then go with drug history and see if he poses a danger to others.
Okay. I want to
That
just
might be too
correct some.
much.
No, I want to correct some of your terminology. Okay.
Okay.
Okay. So neurocognitive is not schizophrenia.
Mhm.
Neurocognitive, something happened. It's a Alzheimer's, a TBI. So schizophrenia is a mental health issue. Neurocognitive is the way it changes the way that I think. So we don't usually put schizophrenia in a neurocognitive disorder. Okay. So there's nothing else. Something else you said. Yeah, something different. Something happened. Something happened. I don't know if they're negative or positive symptoms, right? The positive symptoms are things that are added on, hallucinations, delusions. Those are positive. What he's missing is having a conversation with somebody. His affect are the negative symptoms. Okay, so C is my best answer. Everybody see why?
Yeah.
Okie dokie.
Yes. I
Okay, go ahead.
I came to that answer because I don't know why we would be looking into Mary's mental status and when she just was the person that brought him there. So that's why I ruled out B.
Got it. And there's nothing in that question about she's not in any danger, is she?
No.
Nothing we see of. Nothing we see of. She's just brought him because he's acting crazy. That's the word she said. Oh, okay. Oh my God, it's a subpoena. I don't know what to do. I never know what to do when there's a subpoena. I get so confused all the time when there's a subpoena. Oh my gosh. Minette, take this one. You're muted.
Okay. You have been court appointed to conduct an evaluation and provide a report in a child custody case. You have interviewed each parent separately. The daughter herself is seeing the father and the girl together and the mother and the girl together. 1 week before the report is due, both parents call telling you they don't want you to submit the report. What should you do next? Okay, so you've been court appointed to conduct an evaluation and provide a report in a child custody case. I interviewed each parent separately. I interviewed the daughter by herself, and seeing the father and the girl together and the mother and the girl together. So 1 week before the report was due, both parents called telling me that they didn't want me to submit the report. So what should I do next? A, assert the privilege. B, contact the attorneys. C, ask the court what you should do. C, comply with the parent's request. Okay, I'm gonna rule out. Ask the court what to do.
That's your answer.
Oh, that's okay.
Okay, so let's go back. What's wrong with A? What
Assert
does that mean?
the privilege. So I guess give them the privilege to tell me what to do.
Assert privilege means in front of the judge when he wants me to share. I'm going to say, Your Honor, my client told me this in confidence, and I don't want to share. It's only in front of a judge. I know some tests say it's in front of a lawyer. I can assert privilege. I don't care about a lawyer. He's the same as I am. I only care about a judge. So the judge gives me a court order and he says, Hey, Pam, come on in and I want you to tell me what's happening with this family. I'm going to say, Your Honor, when they told me this, they told me in confidence. I have the privilege of holding their secrets. I don't want to share. I'm not in court yet. I can't assert privilege. Okay. Okay. So then, who do I answer to?
I answer to the
Who appointed me?
court.
Ding, ding, ding. All that matters is what that judge says to me. Y'all know Dr. Pam likes to sleep naked. I want to watch what I want to watch on TV. I can't be going to jail for some stupid stuff like this. I answer to the court.
I'll ask the court, what should I do?
Absolutely. That's all that matters is what does the judge say?
Well, if the judge has already told me to submit it, should I still ask?
Of my 4 choices, remember I assess first.
Okay.
Okay.
So
Now the parents say, we don't want the judge to know. I don't really care what you think.
Mhm.
I only care what the judge thinks. People get confused a lot with the subpoenas. So remember, privilege is what I claim in court. The same way as you told your doctor a secret, you told your lawyer a secret, he can't go up there and blab what you told. So he's the keeper of secrets. I'm the keeper of secrets. So I want to say, Your Honor, that client told me this, and I don't want to share. If he says keep talking, I'm going to sing like a bird because I'm not going to jail.
Right.
I'm not going to jail for somebody else's stuff. Makes sense?
Mm-hmm.
So yes, the court ordered me to do an evaluation, but a bottom line is I only answer to the judge. This is a very typical LC question. This is where I have to know my theorist and know how to treat. Gloria, look at that one.
Which of the following types of therapy would be contraindicated for a client diagnosed with avoidant personality disorder?
What does this mean?
So, which of the following therapies would I use if I had a client that was diagnosed with avoidant personality disorder?
Right. Contraindicated means not recommended.
Oh, yes. Which
Okay.
one would I not use?
Got it. And what are my avoidants?
Avoidant personality disorder.
Mm-hmm.
They, well, they don't like to be around people. No. Yeah.
They do like people. They're just afraid you're going to make fun of them.
Okay. Yes. Yes. Avoidant. I was,
Okay. They'll avoid people, but they really do like people. But they're terrified you're going to make fun of them. So they're very they avoid crowds, they avoid people. They might be in a relationship, but they're not. I've told you I have a friend that's got avoidant, and the biggest fear, I like to cruise, and he won't cruise with me because he's so sure what's going to happen is we'll go on a cruise and we'll be dancing in the middle of the Caribbean, and somebody will somehow take his picture of him dancing because he thinks he can't dance, and it'll go viral. That's a very real fear. He won't cruise on with me because of that. He likes people, but he's terrified that people will make fun of him.
I
Okay.
was thinking
So then,
social anxiety.
but it's a personality disorder, so it's been that way since he was a kid.
Yeah.
And remember, it's egocentric, so he won't go for therapy.
Mm-hmm. Right. Because he doesn't see that that's a problem.
Got it.
Mm-hmm.
And I'm an excellent dancer. I'm the only black girl with no rhythm, okay? But I don't care if I'm having fun on my cruise. I could care less if you get a picture or not.
Uh,
Be good for business, maybe.
so
Okay.
then,
What would I use?
so the options are client-centered therapy, cognitive behavioral therapy, gestalt therapy, supportive therapy. Avoidant personality disorder. I don't think it's just adult therapy.
Well, that's what I would use. I would use client-centered. Who's that?
Client-centered is, hold on,
Carl Rogers.
Rogerian. Yeah.
Yes, exactly, exactly. I'm going to be warm and
Mm-hmm.
unconditional positive regard, no matter what you say or do. I got you, right? I create this warm, fuzzy space. I would do that.
Mm-hmm.
What else would I do?
I would do just adult, right? I would.
What unfinished business is he getting rid of? Remember, Gestalt is unfinished business, the empty chair.
Mm-hmm.
Remember, he doesn't think he has a problem. It's egocentric. What unfinished business?
Somewhere that he didn't feel something happened, maybe that he didn't feel like worth something or made fun
Is he
of.
going, would he do that?
No, he wouldn't.
So CBT, I would do, right? CBT is changing the way that you think. One of the ways that we teach people with egocentric. One of the ways that we make behaviors that are egocentric is we make them ego alien, foreign to your ego. So we
Mm-hmm.
do CBT to change the way that you think about it.
Mm-hmm.
We would do CBT and we would do a supportive therapy group. We would not do a Gestalt.
Yeah, I was thinking, what is supportive therapy? A group. Okay.
The
Yeah, we
people
would
like
do
me.
that.
Okay.
Mm-hmm.
We would
So
not use the
we would
Gestalt
not
because
do just all because he doesn't, what unfinished business is there? Okay.
exactly, exactly, exactly.
Okay, this is one of those like accept kind of questions that I hate those kind of questions.
So I'm looking at the three that I would use, and it could have
Right.
been any personality disorder. They're always egocentric. They
Mm-hmm.
don't have a problem. So get rid of what?
Mm-hmm.
Right? Because
Right.
Gestalt says I can't be a whole person, so I get rid of the unfinished business.
Right. Unfinished business.
Okay. We good? Did we learn something today? And I know that you felt they were hard and harder than, but they're not. This is just an OLC test. And for my LMs, it might have been a little, I tried to pick up some LMs that would not be so hard. But a lot of times we're missing those little small pieces. If they aren't capitalized, some people read right over client-centered therapy. They read
Mm,
right over reality therapy, right over CBT, and don't get that your intervention is based on and your treatment plan is based on what theory you're using. Okay. Questions for me? Yana, you're taking it in a couple of days, you said? Yana, I think we have a bad
I can
connection.
hear. Yeah, can you hear me?
You're taking it in a couple of days?
Yes. Mm-hmm. A little
Did this
nervous. A
did
lot
this make it
nervous.
worse or better?
This made it so much better because there was those little things that I'm overlooking and it just made it a lot better. But I'm hoping that I don't start second guessing myself because of that.
Go back to the question. I don't care what you think. The test doesn't care what you think. What can you prove in the question? Everybody takes the exact same test. We could care less what happens in your office. We don't care at all. All that matters is what does the test, what's the right answer for the test based on what the question's asking me. Bye, guys. Thank you for hanging out with
Thank
me tonight.
you.
bye, Dr. Pam. Thank
Bye.
you.
Thank you, Dr. Pam.